Hello, I'm Jeff Gold, and thank you so much for joining us today on this very special Maverick Minute. I'm joined today by Dr. Nick Stergiou, who of course is the professor and chair of the Department of Biomechanics, and I know you have a number of other titles, Nick, but in the interest to our audience, we'll leave it at that. But we're sitting here in the newly soon-to-be open space of the expansion of the biomechanics facilities. But what I wanted to talk to you a little bit about today is the research program. Specifically, the recent announcement of a major federal investment, a major federal COBRE grant, again funding the research here in the area of biomechanics. And I wonder if you could reflect for our audience and for me about the significance of that, and then to reflect a little bit more on what exactly you're going to study and what does that mean? Why is the federal government so enthusiastic about adding yet another $10 million of research spend here at UNO?
Yeah, so the first $10 million that we got 5 years ago allowed us actually to establish a center for research in human move variability. In terms of human move variability, we have a certain niche. So we study actually why we can never do the same thing the exact same way, and then we harness this information actually as it relates to diseases, pathologies, trying to develop prognostic tools, diagnostic tools, treatments for many of these different problems.
And what would be an example of that?
So for example, like in the new phase 2 right now, we will be working with elderly with falls. We're going to be working with Parkinsonism. While, for example, like in phase 1, we worked on other diseases. We work on peripheral artery disease. We work with chronic obstructive pulmonary disease. So now we are expanding to additional pathologies and disorders, movement disorders actually, that people are suffering from. So phase 2 is allowing us to expand to these other movement disorders. It also is allowing us actually to enhance the careers of young scientists who will be working with these new diseases. We also have another projects looking at 3D printing prosthesis for children who they have actually congenital deformities in terms of their arms. We are also...
And I've seen some of that in your earlier work.
Absolutely. So we are expanding in these additional problems, and the goal is actually to try to enhance the careers of 4 young junior investigators who they will be working on all kind of like different movement disorders. We are also putting with them clinical mentors as well too, and external consultants to help them actually launch their careers. All these young professors are people who they are like now faculty in the Department of Biomechanics. The university also is helping us by putting like more actually wood in the fire by hiring additional actually faculty members that we will be bringing to this.
And that's part of the matching that goes into this type of funding, right?
Absolutely, absolutely. This large grant is providing us also with startup funds for 2 individuals, and then the university is matching this next year with 2 more faculty members. So we are putting like 4 new faculty members. In addition to this, for the first time in UNO history, we're going to have cores, fee-for-service course. We're going to have 3 cores. We are going to have a machining and prototyping core, a movement analysis core, and then we're also going to have a quantitative nonlinear analysis core. Those cores will allow us actually to take a project from the beginning, like let's say, for example, maybe the equipment or maybe the machining that is needed for that, and take it all the way down to the analysis of the data. So this will allow the junior investigators to focus more in terms of the development of the ideas, the experimental designs, the writing of the grants, the writing of the manuscripts as well too. And then also will allow the center through this course actually to maintain its sustainability beyond even the time that I will actually be done with my job.
For sure, we want to make sure that we create sustainability. But let me take you back to one of your earlier comments. You mentioned Parkinson's as an area of study. So if there's a patient whose life has been touched by Parkinson's, or their loved one has been touched by Parkinson's, what could this actually mean to the quality of their life? You know, when it really, as you've probably heard me say, research is never done till somebody's life has been changed for the better, hopefully. And what would it mean in that particular case?
So in terms of Parkinsonism, the projects that we have right now, we are not trying to work on a treatment per se for the specific disease. We are trying actually, however, to improve the quality of life. So for example—
Which is very important.
Extremely important. So for example, like in one of these projects, we are utilizing devices that will allow actually a Parkinson patient to maintain their ability to walk in a more effective manner, to avoid, for example, freezing in terms of their gait.
Or falls, possibly.
Absolutely, falls as well too. And hopefully even through neuroplasticity actually to maintain their capabilities for a longer period of time until our friend scientists, maybe in genetics or genomics, will come up with, the treatment, the drug that will actually
Sure, I mean, eventually we want to be able to prevent, have early diagnosis, and then have effective treatments that cure. But in the meantime, and for probably a long period of time, we're going to need ways to improve the quality of life of these patients, and it sounds like that's exactly where you're focused. Well, I know there's a lot more to come. I very much look forward to the ribbon cutting of this new facility, and we'll have plenty of time to talk about that. But I want to personally thank you and congratulate your team on the planning, the meticulous execution, and the prestige that you bring to UNO for this wonderful award.
Thank you, Chancellor. It's a team effort. We have a fantastic administration here, including yourself. We have some really, really good people, excellent students, hardworking faculty. People, they flock here from all over the planet actually to work with us. So we have a fantastic team, an excellent reputation that it just keeps getting better and better and better by the day, but it's also the support of the administration and fundamentally also the support of the community, our donors, who they are helping us actually with every step on the way.
Without a doubt, this is a unique public-private partnership. Thanks so much for being with us today.
Thank you.
And thank you for being with us today on this very special Maverick Minute.